So hello everyone, welcome to this second webinar on our position paper in social policy. We are going to go over slightly the strategy process and the timeline just to make sure we are all on the same page. And then we are going to focus our discussion today mostly on the recommendations or on the first thoughts about that. You have all received in advance the same presentation and also a Word document where you could see some leading questions, which I would like to discuss with you today, and also some draft of recommendations. So please have those close to you. I also have the possibility to go to that document here. Some housekeeping. So for now, you are not yet having the possibility to intervene and speak. As I go through the first slides, we will then open the discussion, and at that moment you will be able to use your microphone to raise your questions and engage in the discussion. In the meantime, if you have any questions, please write them in the chat box that you have on your left, and we will follow them up. And during the discussion, if we are too many and it gets too crowded, you can also raise your hand when you want to speak, where you have an icon at the top of your window that you can use to raise your hand. So I'm not going to go through these steps again. Many of you have already been part of the process so far. We also have some of you who are joining us now, which we very much welcome. So I want to be sure we are all on the same page, but also I hope you have seen this in advance. So just to remind us all that we have had various steps until here that have contributed to what we are to the position paper and the content that we are including in the position paper. And so we are very much using those and basing the position paper on those steps. A reminder on the strategy, we would like the position paper to be having a strong and inclusive process. And this is also why these webinars are so important for us, to have a quality and strategic position paper, so in terms of the actual text and the content, and then to have a strong and wide dissemination where many of you will certainly be part of that process of the dissemination. So we want to keep these three strong lines, and at the moment we are focusing a lot on the, of course, being strong and inclusive and getting to the quality and strategic position paper. But as you've seen in this latest presentation, after discussions with the Council of National Alliances and the EURORDIS Board of Directors 2 weeks ago, we have also started talking about dissemination, as it somehow links to how we also plan the paper. A reminder on the timeline, we have started, I would say, 10 years ago with all those steps that were in the first slide. But more recently now, we have started in September with our social policy advisory group. We have had by now twice discussions at the Council of National Alliances. However, only once at the Council of European Federations in last October. We have had a webinar in December that some of you have joined. And we are having the webinar today. We may have a webinar, a new one later, as we need, if we need to arbitrate some content or refine that. But we are expecting that the consultations from now on will be happening a lot by email, as we will have texts and amendment or commenting on the actual text. For now, we have not circulated the first draft. We are struggling slightly with the amount of content and its scope, despite our strong outline. And this is why we are working a lot on the recommendations now. So going back to the beginning, thinking what we want to achieve with this position paper and making sure that the text is drafted to get to those objectives. We expect the paper to be adopted in November by the EURORDIS Board of Directors, from when the dissemination would start. In terms of groups that we are involving, so at the core, there's our social policy advisory group. We're also straight communication in communication with the European Public Affairs Committee, which includes the board of directors as well of EURORDIS, and we are consulting members through the webinars mostly, and also trying to have as many discussions as we can at the meetings of Council of National Alliances and European federations. Later, we expect to consult external stakeholders at the second draft stage in view of them endorsing our paper. So that would be mostly social stakeholders or other European organizations that would be able to endorse our paper. A reminder of those, many of you are here today, a reminder of those who are involved. In terms of the content, and we've been through this before, so what I just wanted to highlight today, you are already very acquainted with all this, so I'm just highlighting that we are trying to focus on the game changers. I think as we move forward, this helps us to really manage the content and the quantity of content that we have, and the scope in terms of making the content more stronger, the message is stronger. I just saw Marlene is asking a question regarding the stakeholders. If we can add academic associations, yes, we can, definitely. So if any of you has any input on the stakeholders, I haven't had the chance yet to list much. We have some obvious ones, like the European Social Platform, EuroCarers, the Association for Carers, and some other ideas, but please do send them over. Marlene, we will note that one down, but if you have any other ones, any of you, stakeholders that you think would be interested or would be interesting for us that they endorse, do send them over. We're going to start listing that as we move forward so that we can approach them. Also, if you know who would be a contact person, that would be great. Someone you know that we could reach out to. In terms of ideas for dissemination, so this is new from our last webinar. So we have started looking into the ideas of the format of the paper itself. So to have an executive summary, as we expect the paper will have more pages than we can read in a short time. So we want to be sure that the executive summary is there. We have also discussed to have infographic elements in terms of what are the results of the survey, and also to include quotes or case stories from patients and carers, and any visual illustrations that help to understand, for example, rare disease specificities. Also, we have discussed the possibility of having a glossary. I'm just giving the example of integrated care, but there are other terms where we sometimes have doubts, what do we mean? And it may be helpful to have the glossary to get that out of the way and make sure it's understandable what we mean with our terms. We have some ideas about how we launch the paper. So we have discussed maybe Rare Disease Day 2019, but it would have to go along with the actual plan of the theme and slogan. So that's not yet sure that that's a possibility. We have also thought of doing it back to back with a meeting of Council of National Alliances, potentially, but all that is yet to be seen. And we have thought of different formats where the actual content of the paper can also be disseminated. A summary PowerPoint presentation, for example, a fact sheet per each of the pillars, including rare disease specificities, then relevant quotes, data from patient surveys or studies, and recommendations that we make. We have also been asked by colleagues in Spain if we could do a members webinar after having the position paper to discuss how do we present it to our stakeholders, maybe involving some of you as speakers actually, and discuss how do we present it at national level or at disease level. And also we have discussed to support the national alliances, and this was discussed at the recent meeting with the Council of National Alliances to support them and help to support them in preparing the dissemination at national level. So we are thinking of ideas of how we could do more in that sense. So you remember that our departure point was this cloud, and that wasn't complete, but was a lot already. So that was to give us the idea of the different dimensions in our content and the how broad it is and how much it is. And we, at the core of our discussions, I think are a few ideas, which is why in the beginning you see I called social position paper, as we may not be calling it exactly that. But what we have at the core is the social and support services are close to the patient, but they are far from this expertise on what rare diseases are and what the consequences are. And specialized services are crucial. We know that, whether it's healthcare services with the centers of expertise and the European reference networks, or specialized social services with resource centers for rare diseases and other services. And we have discussed what works for all people should work for rare diseases. So in the social field, we are trying to integrate ourselves into mainstream policies, as the policies are not driven by clinical areas. So we are trying to make sure that our specificities are taken into account in those mainstream policies and services. And so our endpoint, and now you know the outline very well. There have been slight refinements since our last webinar, but it hasn't changed majorly. And when we are putting together the content, just for you to have an idea, only with references, there were 18 pages already, and I hadn't written any text. So that's why I thought it would be useful also to go back to the endpoint. What do we want to achieve? Actually, globally, what do we want to achieve to improve the daily lives of people with rare disease, and therefore, what messages do we want to get out in this paper? And we have discussed overall vision. We can have an overall vision, and that's fine. And then we would like to have specific recommendations, which are transformative, ambitious, so that we can say in a few years that he's a success for us, that has really changed the lives of people with rare disease, that they are specific and doable, and whenever possible, that they can be monitored. So when we put all this together, it's a hard task we have here today, but we won't be solving all the problems today, but hopefully we will get to scope. And you've seen, as I drafted the first draft, you have 3 pages of recommendations. Then we can divide them, of course, in national or European, if that seems to make sense in terms of the content as well, or we can make the recommendations all together per pillar. So that I'm not so worried about. I think once we know what we want, we will organize the content to make it the strongest possible. So for the content outline, and I've added something since our last webinar as well around the title, but I propose we do not discuss the title today, but you will receive, when you receive the draft, please do comment on what the suggestion will be. And the suggestion planned is something around holistic person-centered care rather than social policy, which is more restrictive in relation to the content we actually have. So as you remember, we have the why section where we set the scene about our needs and about why taking action is needed. Then we have our pillars, and 3 pillars that we have consolidated your different inputs, and we've gotten to these final pillars, although the actual wording, we can still change it. It's not written on stone, and it's a bit complex in terms of title for each pillar, so we're going to work on that. But now, for the sake of you understanding what's in each pillar, we kept it as it is. And then we have our 5 cross-cutting priorities, which we have seen they are important in anything that we do. And they seemed very important to be mentioned here in this position paper. So we have currently pillar 1, quality, adequate social services and policies. So we are more on the social sector, whether it's mainstream or the specialized approaches. We have the integrated and holistic, so health and social care, and maybe broader even with research. And so the patient at the center, the needs of the patient at the center, and the global perspective on that. So it involves everything around the coordination of care as well, and the exchanges between the coordination and exchange of expertise between the different sectors and services. And we have pillar 3, which is the broadest, the one we have less experience, I would say, collectively writing positions on or working on, and that's the equity of rights and participation. That's the current framing. And that includes three, I would say, main big topics within everything around disability, autonomy, and accessibility, issues around adapted and sustainable employment, and then issues about non-discrimination or more broadly equal opportunities as other citizens. So this is where we have our three pillars at the moment, and our cross-cutting priorities of we need still also to refine the text slightly, but the integration into national rare disease policies as a key element, patient engagement and empowerment, including also psychological support and peer-to-peer support, something that has been brought at the CNA meeting and at the board meeting. Knowledge and generation sharing, so everything around the training, the exchange of expertise, systematic data collection, anything related to knowing our status of quality of life and the impact that services may have to improve it. And then of course the never to neglect the last pillar, which is the adequate and sustainable funding. And we have the last section, which is the one we have worked on less, I would say, in terms of the defining the outline. But we have all agreed that it would bring back the reasons why, how is this impacting the life of people with rare disease, mentioning the different dimensions, and ending with that in view of encouraging different stakeholders to take action and understand what the impact of those actions will be. Marlene is asking us a question. So before I open for the discussion, I'm gonna take that one already. So Marlene is asking us, does being on disability leave and at that status being able to volunteer and get educated is one of the topics on number 3? I would say yes. I don't know how developed, but it can definitely be mentioned. Yeah. And now the juice of we get to the exciting moment of today's discussion, which is, so I've sent you these leading questions in advance. I know that the question one is very hard. So I know we are not able to solve today all our vision, but I thought it was important to put it there after also discussions with the CNN board, that we just think about it to ourselves. What do we want to achieve in the next 10 years to improve the daily lives of people with rare disease? And so I asked you to imagine that a person with a rare disease and their carers were living the best possible life. I know how hard that is with the differences between our different diseases and contexts and the support we get at national level. But generally trying to make that exercise and to see what's the most important change that needs to take place for that to happen. So I'm very interested to hear your inputs on that. And then I have asked you as well to consider the 3 pillars of our position paper and our cross-cutting priorities, and to list 3 to 5 recommendations aligned with those pillars and priorities. Now, we're not going to be able to, of course, go through in detail 3 to 5 recommendations for each of you, but I would be interested in the ones that you've thought most important, and then of course you can send by email your specific recommendations. I also sent you a document with recommendations that I have drafted. They are not shared at all, so just shared with you, and they are first draft that I put together. So I suggest we do not try to amend them today during the webinar, as it's a heavy exercise to go through a document specifically. But if you've seen things there which have made you tick, which have made you wonder, or things that were missing, and keeping in mind that we would like the recommendations to be transformative and ambitious, specific and doable, which I think that first draft is lacking still, and possible to monitor. And I would say we want to keep them to the most important, maybe, because we may have a lot of recommendations and sort of make our messages a bit diluted. But maybe you have a different opinion on that. So I'm going to open the discussion. So you will be now able to use your microphones to speak. You can also raise your hands if you want to, if we are too many that want to speak at the same time. So we have Dorica. Dorica, go ahead. Dorica? Well, maybe so Jean-Marc is sharing with you for if you're having any problems with to enable your microphone, Jean-Marc has just sent you some help that you can have a look at. In the meantime, Isabel from Spain has let us know that there is no microphone, so her microphone is not working. So if you would like, any of you who don't have the microphones, you can write the questions also on the chat box. Yes, I hear someone.
Okay, it's me, Dorica. So I like very much the exercise to imagine a happy person with rare disease. I think a person integrated into a community which is aware about rare disease patient needs and empathic with people affected by rare disease, having access to care, education, training, and adequate workplace at the right moment and in the right place, getting their rights and compensation for equalization of their opportunities. That is the person with rare disease very happy in the community. And I think the most important change that needs to take place for that to happen is to train and train, train.
Train, 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 you said, Dorica, right?
Yes.
We were having a slide.
Of course,
And
the
is that
environment
train?
has to be adapted to the people needs, but training and education and cooperation is the key word here, I think.
For those of you who want to remember what Dorica has just suggested in terms of the vision, Dorica has written it in the chat box as well. So train, education, cooperation. I see Nick is raising the hand as well. Thank you, Dorica.
Hey everyone,
Nick,
can you hear me?
yes, go ahead, Nick.
I just wanted, so my colleague Rose is on the call as well today, and one thing I think we would be missing in the current, especially Pillar 2 around integrated and holistic health and social care is mental health. So we have a concept in the UK that people are trying to build up called parity of esteem, where you would essentially treat the mental health of someone to the same degree you treat the physical health. And Rosa is just putting the finishing touches on a project that examined the mental health experiences of people living with a rare disease in the UK. Rosa, would you like to just talk a little bit, very briefly, about some of the findings that we've had?
So some of the key findings. So some of the key findings that we have come across so far are that mental health services are not well integrated. So lots of patients and carers described almost a tug of war between the mental health services that they might see and the physical health services that they were under. They also said that often mental health services are not well tailored. So when they access psychological support, for example, it's that those that provide the psychological support often don't understand the specific needs of rare disease patients or carers. So they were some of the key findings so far that I think chime with some of the recommendations that have been made within this piece of work. Was there anything else?
Thank you. Thank you for bringing that. I think that aligns with the first. There were some concerns at the board meeting as well that were we refer to psychological support, but I think that aligns very much with what was also the idea that was behind those interventions. Would you be able to send me some of those preliminary by a quick email, and then maybe when you have, we have until November if your studies are ongoing, that we can actually quote you later if that's going to be quotable, but it will help us to. Okay, perfect. I see we have Vlasta and Marlene also raising their hands, so I'm going to give the word now to Vlasta.
Yeah, hi everyone.
Hi, Vlasta.
What I wanted to say, and I told you already, we are always talking about persons living with rare diseases, but that person need a time to be independent person and person able to cope with its problems. So, and that depends on a family. How family will cope with the problem and raise a child to a independent person. So I think that we need to take care about this support for family to be able to raise an independent child as much as possible. I think that this is very, very important.
Thank you, Vlasta. We have to integrate that and see. I think it's across the different pillars, probably, and not just in one.
Yeah.
But it may be just one recommendation or a few. But we have to see how to best integrate that.
Yeah.
I see we have Marlene and Elene. I'm going to give the word to Marlene, but I'm just going to take the chance also to go to our chat box. I'm hearing some echo.
Hi.
On my.
It's Marlene.
Okay. Marlene, can I just keep you a second and just go through,
Yes.
just highlight that Isabel from Spain and also Anne from Ireland are also giving us some inputs through the chat box. So we're going to get to them in a little bit, just to let you know, Isabel, Anne, and all the others who are able in the meantime to have a quick chat. So now I go to Marlene. Thank you, Marlene. So we have here the issues about mental health. So it's clear to me that we are several of us concerned and worried about that. And the volunteer opportunities, so that adequacy and that access to opportunities that allow us to remain active, whether that's paid or through a paid job or through a volunteer opportunity, and that there are no legal barriers, right, to actually be able to do so. Eleni, I know you're there. I'm not going to give you the word yet, just to recap a little bit here on Isabel and Anne, if that's okay with you. So Isabel has let us know that in less than 10 years' time, we should achieve a clear road for coordinated and holistic care in all aspects related to rare disease patient education, social and health aspects. For the national plans of integrated care for rare diseases national plans of integrated care for rare diseases should be compulsory in each country and in Europe. Because Isabel says as a comment that we all, I think, subscribe. If something is not approved by law, then it will never happen. So that need for the actual legal framework to be there, and that patient organizations, for patient organizations, we need to have that clear plan for rare disease approved by law. So Anne from Ireland also gave us some input. For some rare diseases, individuals are already genetically predisposed to mental health problems. So Anne is here contributing to the points that Nick and also Marlene have brought forward. Our business plan to our health service highlighted this fact, so the organization that Anne is involved in, and asked for coordinated care that is developed to include psychiatry from the beginning. So here we have an example from Ireland that maybe we can be inspired by and use. The mental health of carers and families is somewhat different, said Anne as well. So I see that really the trend of the mental health today is really important, an important message we should take. So now I go to Elene, and then we have also Simona. Eleni, hi.
Hi, everyone. I just wanted to say that just a second, because the microphone is like, okay, good, now it's working. Okay. The thing is that we totally agree with the mental health part, but we are not quite sure whether we should present it like mental health or psychology, because the right to happiness is a psychology issue, and everyone has a right to happiness and to a healthy, let's say, psychology. So I think we need to further study that. Now, here in Cyprus, we have been discussing everything you have sent us, Raquel, and we totally agree with everything, and we thank you, because you have shared with us a very comprehensive list of recommendations and a very clear structure. What we thought that is missing, because there is focus on the patient, on the family and the surrounding and the environment of the patient, and there is a focus on policies. Now, we agree with the patient part and the benefits and the training and the family part with education, but we haven't seen anything about bureaucracy and fast-track processes for patients with rare diseases. So it would be great to somehow, somewhere include that, because this will solve many of our issues, and we cannot reach an ideal life, an ideal daily life, without this, let's say, very special arrangement at national level. Okay, thank you for that. Thank you. I will be just adding some more comments.
Eleni, can I ask you a question?
And I see that Spiros has written something. Thank you, Raquel. Thanks.
just to confirm with you, so the fast tracking processes we are talking about, for example, all the papers we have to fill in and hand in terms of different supports that we are trying to
It's
access
about
and services.
paperwork and the time
Yeah.
it takes.
Okay.
We think that it's really important.
Okay.
We absolutely have to mention that somewhere.
Okay. Okay. Now I understood. I think it's true. It's not there, and I think it's a major bottleneck. Thank you for highlighting that, and I think it can be easily integrated in those recommendations about, I would say, the ones on the structural changes at national level that could be easily included. I'm also, as we are discussing, and Simona, I know you're there. I'm getting to you. As we are discussing, I just want to let you know that I will send you the actual editable, the Word document after these discussions, integrating as much as possible the points raised today. And then I will ask you to actually really amend or comment directly on text as well, so you can provide additional input or wording suggestions as well. In the meantime, there's quite some action in the chat box as well. I will get back to the chat box. First, Simona. Hello.
Okay. Hello, I'm here. Can you hear me? Yes. Okay.
Yes.
No, I pointed out already several times. I think within the mental health, which is of the utmost important for me, is also to divide it within the severe mental health issues and the mild mental health issues, because it will bring us to different recommendations. We are talking about integration and inclusion, and I fully agree on what has been said already, but even the training, the inclusion, it will be completely different. Depends on the level of the severity of the mental health condition. That brings us to more support to the caregiver, and I mean the family, or we can focus on the mild mental health condition to the need of tutors, well-trained tutors in school, and to be a sort of link between the school period to the job inclusion. So we need to, for me, also to focus on the differences between the mental health issues, because, as I said, you know, it will bring us to different recommendations or suggestions, and we need tutors, you know, to take this person from the school period, which is a very, or could be or should be a very safe environment, to the job, to the workplace, where people are not ready, where enterprises are not ready. Initially, they have to, but they would prefer to pay a fine, not to hire disabled people, because the fine is very low, but because they don't really know what they are, what these conditions can be also an opportunity for them, because they find that it is an hard job to hire disabled people. Yesterday, I attended an event where a video curriculum vitae was presented, which is a fantastic idea, because this could be part of, you know, the suggestions we can give to even patients' organizations, because on the curriculum vitae, you only focus on what you are not able to do, while in a video curriculum vitae, the person could be presented as her best, and it will give an idea, you know, to enterprises, to the public, the broader public, of what they are able to do. but we have to train tutor, and we have to focus on the fact that we need tutor to be a link to accompany this person from the school to the job and to follow them, not to abandon them once their job is finished at the school. And they need the same person to do it. This is what I think we should highlight somewhere. Otherwise, if it is a very severe mental health, it's obvious that we have to focus on the caregiver. And I sent you a law initially, even though it's a national law, but it is implemented at different range at regional level, where there is also an economic benefit, recognition to the parents. And this is very important as well. So best practices, they are throughout Europe, and we should quote them.
Thank you, Simona. An important point about the distinction between the different levels of mental health and the support, and what our recommendations will convert into, and also the aspects of access to schooling follow-up and training follow-up and access to employment. So I think one of the points also that I find interesting, Simona, is that you said maybe we can recommend to patient organizations, which made me think, maybe we can recommend things to patient organizations, recommend things to ourselves as a collective and based on the experience of many of us. So I leave it there hanging. Another thing which made me think, again, when we are discussing, listening to all of you and listening to Simona about the different levels and how that changes the recommendations, when I think about this transformative, ambitious, what do we mean about transformative? I would say that when we are reading the recommendations that we have, we should have quite some in there which have a consequence that impacts different areas of the daily life issues. So I was listening to Simona. There was one aspect that Simona mentioned that was on the training, for example, which can affect the different areas depending on which training it is. So I think when you look at the recommendations, I will ask you to actually think, or maybe we can I can list on the side of comment, and how do we think, which areas do we think this can have an impact on, so that we actually realize to ourselves how transformative they are. And then listening to you, it seems clear to me that besides those transformative, which affect many areas and will be a game changer very broadly, we also will have some specific recommendations that affect a certain area because they are needed. And what's interesting about those is that maybe they are more doable and monitorable, because maybe they are less structured as they are in a specific area. So I see that as we go through, we may have these two levels, and I will make sure to try to make you the right leading questions to get to that. I have here in the box, we have quite some exchanges going on in the chat. So I don't know if you have been able to follow at the same time as we are discussing with the microphones, but I'm going to pick up again on a comment from, so Marlene is sharing with us some associations, which we will note down, which could endorse our paper. Anne has also brought up a point about, it must be said that there are considerable similarities within the disability sector and rare diseases. And the disability sector has done a lot of work on inclusion policies. Has there been any conversation with them? Yes, we are establishing contacts with the European Disability Forum, also in the scope of the NGO committee at the United Nations. We are with International Disability Alliance. I'm not sure how that will convert. We do want to approach them in view of endorsing the paper, so we hope that that will be a possibility, at least in the relation to the contents more directly related to disability. On the side of that, we have been working internally on a fact sheet about rare disease and disability, which we haven't published. It's an internal document we're using, but we are collecting important references to make exactly that match, and that you were mentioning about the similarities and how disabling are rare diseases, and in which aspects in considering disability as in the broad concept of WHO. So we expect to have some good argumentation on the paper there, hopefully with some data, and we believe our data is quite solid to start that conversation with using data from our survey from last year as well. We also had another comment from Cyprus, from Spiros, who said in Cyprus there is a variety of committees to examine the disability regarding the matter of social benefits. All these committees use different standards, and this creates an unfair situation. In order for that matter to be addressed, all EU member states have to adopt the European term of disability. Now that's an important ongoing task, and about making these disability assessment systems, which we don't even really know what the right wording is sometimes, but those methods that are used to assess how much a patient is facing disability, and to provide in many countries with a percentage or with a level that then gives them access to certain compensation. So there are big disparities there, as Cyprus is mentioning, and we in the recommendations are pushing for rare disease specificities to be considered, also taking into account the work being done by Orphanet with their disability treasurers. And we may want to enlarge that, or at least to support that work and that message of trying to eliminate disparities in Europe, and between diseases and between people, I would say, even. Then we have a few more comments. So some of you are having to leave, so we have also some goodbyes, and we have some more comments. So Marlene, that once we have the paper, we can look into getting good practices from various countries and add it up, as I think that's really, really interesting to actually have those sources of inspiration. It's always very appreciated as well by the different stakeholders. So I think that's a great idea. And we have also another comment from Spain, from Isabel, as giving the example precisely of in Spain, the patient organizations work closely with the disability committees to help them to identify the needs and provide information about rare diseases, so that these assessments are done more adequately. And that's Isabel, I think that's a very interesting case study. I've brought it up several times recently, and it's one of those why we could include in such a list that Marlene was suggesting with the experiences from different countries. Annie is also bringing us the importance of transition to adulthood, so that we keep that in mind, and this idea of lifelong support, and making sure that transitions are well followed and supported. And we have then the exchange ongoing between, so reinforcing also what Simona has said, and that there is a lot of work in that area in the disability sector, and also Spiros, who is supporting the idea that Marlene brought forward about collecting examples, and taking also the example from Spain in terms of disability assessment. Annalisa, who has sent us comments in advance. Actually, Annalisa, I do have them here with me, so I'm also gonna highlight a little bit. So Annalisa also suggests that we add to the document some points about schooling, work, caregivers, and spare time. So Annalisa sent us some comments in advance about the issues around schooling, and that we need to have not only specialized teachers, but also educators that guarantee that there's a real follow-up. the right to work, so something that is in the paper, and here Annalisa also referred to physical disabilities and mental, so again the mental aspect, to guarantee the dignity at work and the chance to training in respect to also access to work. The caregivers, which are very much at the center of we want to try to make them very visible all throughout the paper, as well as undiagnosed people with undiagnosed conditions. So Annalisa is strongly also bringing that perspective, and the spare time, which is something we have not discussed much. So I think it's a point that has been brought really now by Annalisa about the right to actually have spare time, proper leisure time, and activities that really contribute to our well-being, such as sports or adapted holidays, etc. So Annalisa, I think that last point we haven't given yet so much thought, so we have to see how, if there's anything we can recommend there, or if that's a consequence of the more transformative recommendations as well. So we are also having here some more suggestions regarding the disability aspects, for example, that we reach out to Inclusion Europe and to the associations of people with intellectual disabilities. If any of you, Anne or anyone else, has specific contacts within that you can either put us in touch with or just let us know the email, and that we know that that person is one of your key contacts, then we can use that to facilitate the first exchanges. And we have also Rosa Spencer from the UK, who is giving us a bit more on the study. So that was mentioned earlier. Our study in the UK found that one of the greatest triggers for poor mental health can be trying to navigate the system, including especially social care. So the relationship between social care and mental can be very complex and might be important to highlight. Thank you, Rosa, for also bringing that forward. It also, for me, it's clear that some of our transformative recommendations will contribute, for example, on integrated care to improve that, but maybe we need to be specific. We often refer integrating health, social, and local support services. Maybe there's something we have to do about the mental health if it seems that it's not being perceived as being part of when we refer to health, that people are thinking more of physical rather than mental. So we have to think about the right framing. So I will certainly come back to you, Rosa and Nick, as well, to refine better that, and with the support maybe of Simona and some of you who brought forward the mental health, to make sure that we make the right specific recommendation, and we make transformative recommendations that also affect how the mental health aspects are being taken into account. I think I've covered most of our chat box. In the meantime, if anyone wants to use the microphone again, please do raise your hand so that we hear other voices than mine. Elena is coming back from Cyprus.
I was ready to write my comment, but I thought, okay, it's okay. Let's see. Raquel, I don't know if we have discussed anything about infrastructure. That is a major problem for all patients. And as far as infrastructure is concerned, it's not only accessibility to the building, but it's also the design of the rooms and houses and the environment of the patients. So we think that it's something we can also add in our thoughts. Thank you. Also, I was just reading through the comments, and I read some really nice recommendations and some really good practices coming from Spain and other countries So maybe in the meantime, in parallel, is it possible to create a good practices booklet? This will actually fit into our recommendations. Thank you, Eka.
Thank you, Eleni. I think we can start the exercise from now. As long as we are aware that we are not able to be maybe exhaustive, but we can make it available to everyone, and so we can make a collective, collaborative process, and we can start contributing. Clearly, some of you already have experiences we can put there, and then we can disseminate that to our members, and that members can contribute progressively, and maybe we will get a lot of input from the members. Maybe we will have to remind them to later, but I think when we have a starting off, we should start now. I agree with you, Eleni, and then we enlarge progressively, and as long as we're clear on the kind of exercise we're doing, so that members understand that it's their contributions. And we would very much base it on your contributions, as EURORDIS wouldn't be able to really be calling each of you. So I think you are there. We have a few ambassadors here who are starting the process, and I think once we start the process, there's always also an encouragement for others. So I'll see how we can do that in terms of a collaborative document, maybe a Google Docs or a simple solution that everyone can contribute to, or otherwise I can centralize that myself. I also saw that there are other comments coming in the chat box, so I tried to catch up from the last ones. Marlene has brought another comment on in Samia Ren's transition from pediatrics, so here referring to the transition to adult care is a huge focus point. So add the RNs as stakeholders and ask them for examples. Good idea. And so as we already heard from Eleni, that we start the good practices. And Maria, yes, I was going to ask Maria. I don't know if your microphone is working. I was going to ask if you had any comments precisely on Eleni's point about the infrastructure, not just being about accessibility and buildings, but the whole design of the environment. I don't know if your microphone is working, Maria. If it is, raise your hand. And if not, I'll pick up on it.
Can you hear me now?
I can hear you.
Okay.
Yes.
So about the question about the universally designed environments and so on. What was the question? I didn't quite get it.
Yes, Maria, I think you're speaking maybe a bit too close to your mic. We're getting the sound a bit too strong. Yes, I was asking if you had, so Eleni was making the comment about the infrastructure and how that's a bottleneck, not only in terms of building accessibilities, but also the designs of the houses and the whole environment, and whether we should make a point about it.
Okay. Is this better? Can I talk like this? Or am I too close to the microphone still?
I still hear it a bit loud, but...
Okay, I'm sorry. I think connecting this position paper to the UN CRPD and the implementation of that UN convention could be a good thing. And then when it comes to environments and universal design, it would be especially the Article 9 of the convention, and just make stronger references to that, because as several of the other participants in this meeting, there is a lot of things going on, and if we can connect this position paper to what is going on in other contexts, for example, the UN Convention implementation, then that would make it stronger, I think. But then it goes Article 9, and then also Article 9, the special committee, the Disability Convention Committee in Geneva, they have written general comments on how Article 9 is to be implemented, and I can send you that, Raquel, if you would like to. And then those universally designed environments go for the whole society, so the education sector and the employment sector, and how the principle of universal design and inclusion should be becoming reality in all the different societal sectors. So I think if we could connect this position paper stronger to the implementation of the UN CRPD, and even if not all European countries have ratified the conventions, then the EU has done that, so it should be implemented everywhere, anywhere. So yeah, it was just a thought, I don't know.
I think that's thank you, Maria. I think that's a good point. And Maria was also writing in the chat before some relevant articles of the UN Convention on the Rights of Persons with Disabilities, which we can link to in our recommendations to make our paper stronger, as Maria was saying, and linking that to the implementation in terms of the disability aspects to the implementation of this convention. That is going on in the European countries. So I think it's very useful, Maria, that to have the articles and to link specifically. It may be also interesting, as we were discussing before, to as we are reaching to disability organizations. I'll have a look at if I can find any recent positions from them around these issues that we were discussing, any recommendations that they have made, which we could maybe transpose to our paper or sort of endorse as well in parallel, or use the same language sort of to be stronger together with the disability movement. We're also having, so we have some Eleni that supports the points also that Maria has raised. Annette Dumas, who works with us at EURORDIS, and many of you have met her as well. She's bringing some points on mental health, where she has some experience working also with other organizations, and suggesting that we look at European action on mental health and well-being, and that the WHO Mental Health Action Plan as sources we can link to or inspire ourselves from. And supporting in terms of the disability, the UN recommendation and also the Sustainability Development Goals. So, and we are bringing some inputs of different documents. This is very useful. Please continue to write. As we have collected with Annette already some and within our team, and we are collecting relevant hooks, policy hooks, as you've seen at the end of my at the end of the document I sent. And if you know specific areas in those documents, as some of you are mentioning specific articles or areas of those documents, that's really, really useful, so we can inspire ourselves. And when you receive the document, if you want to amend, I will ask you to provide as much of that as possible. I will integrate now what we have, but then when you are reviewing, please do provide the sources, the policy hooks and the articles you believe are the best to refer to when you are reviewing the document. In the meantime, we will copy those you have suggested in the chat box. So we are 3 minutes after afternoon. So we have spent our hour, and I would like to ask you if there's anyone else who has any specific burning comments. Or else, I see that some of us are still writing in the chat box. For the next steps, so I will integrate the comments as much as possible from what you suggested today. And then my intention is to circulate to you that Word document. I will always send you this PowerPoint presentation in case you need to check it and have any background on the status where we are on the position paper. But the next step will focus on these recommendations rather than the actual draft. I hope you're okay with that. So you'll be looking just at the content outline and what we want to recommend without seeing the text that we are writing. And I would like you to provide your input, amend those recommendations, and provide additional, change the wording if you find, or bring up wording suggestions. And once those recommendations are in parallel, I'm writing the text, but once they are more refined, the idea is that the text is really aligning towards those recommendations so that everything we write there goes in the direction of what we actually want to achieve. So I'll try to have some leading questions for you as well, in case some of you prefer to provide overall comments rather than amendments. Thank you, everyone. It was a very, very interesting, useful, and intense discussion. I'm very fortunate to have all of you here, and also some of you who regularly take the time to really support this position paper. And I highly appreciate that. And so I will come back to you, all of you, by email, and maybe we will need another webinar to arbitrate. We will see with the progress. Thank you. Thank you, everyone.